Hi, my name is Amber Johnson, and my presentation is on the effects of sexual activity on adolescent females. A survey conducted in 2011 to 2013 found that 44% of females between the ages of 15 and 19 years old had sexual intercourse. Considering this large female teen population is sexually active, it is important to study the consequences of early sexual activity and its effects on the adolescent female and society. Early engagement in sex can have detrimental effects on adolescent females. These effects range from acquiring an STD, teen pregnancy, and social and emotional ramifications of sex at a young age. History of adolescent sex. Sexual activity among teens is nothing new. However, society is seeing the negative effects more and more. The sexual revolution that occurred during the 1970s affected adults as well as adolescents. And along with an increased sexual behavior in teens came a dramatic increase in the negative consequences of careless sexual activity. The acceptance of casual sex that began in the 1970s continues to impact young females in society today. Number 1. Adolescent engagement in sex can lead to an increase in sexually transmitted diseases, or STDs. This increase in sexual activity in adolescents can lead to more sexually transmitted infections. Almost 50% of the more than 19 million STD cases reported each year are in young people ages 15 to 24. Adolescents are unprepared to engage in sex, and the large number of STD cases illustrates this. A 2013 study supports a link between early age of sexual activity and contraction of STDs. The study cited a lack of adequate experience, knowledge, and skills necessary to negotiate safe sex during sexual encounter as likely reasons why youth are at an increased risk for contracting STDs. An additional consequence of an STD can be infertility issues experienced when a female reaches adulthood and is now ready to begin a family. Past infections of gonorrhea, chlamydia, and pelvic inflammatory disease can cause infertility issues as an adult. Number 2. Early engagement in sex can lead to pregnancy in teen females. When a teen is faced with an unplanned pregnancy, she has some hard choices ahead of her: to keep the baby and raise it, give the baby up for adoption, or have an abortion. These decisions are not easy to make, and each has consequences. If the teen decides to keep the baby and raise it, she faces limited educational attainment, marital instability, and restricted economic opportunities compared with her peers who delay childbearing. Because this young lady is still in high school, is still growing physically and mentally, and is not financially independent from her parents, she's automatically at a disadvantage to offer her child the benefits that come from motherhood at an older age. A teen mom has many challenges that an adult mother does not. Some teen moms may opt to place the baby for adoption. For women with stable relationships or the resources to raise a child, an unintended pregnancy might not present much of a hardship. However, for many women, an unintended pregnancy can lead to serious consequences. Due to a lack of education and resources, a young girl may feel she has no choice but to place her baby for adoption. She then must live with the emotional fallout that results from that decision. The most tragic option for a teen facing an unplanned pregnancy is an abortion. A young girl may decide that abortion is the best option for her. There are a range of emotions that a woman may experience after an abortion, such as relief, shame, guilt, fear of disapproval, regret, anxiety, depression, and anger. The lack of support from her family or her partner can cause some females to develop serious psychological problems. Number 3. Psychological and social consequences of adolescent engagement in sex. Early sexual activity may lead some teenagers to develop psychological disorders, such as anorexia nervosa and bulimia, while other adolescents become involved with promiscuity, pornography, or prostitution, suffering both the psychological and physical consequences of these actions. A big impact on females and society is teenage motherhood. Many teen moms find that their educational future is now in jeopardy. A lack of education increases the chances of living in poverty, and over 3/4 of unmarried teen mothers began receiving welfare within 5 years of the birth of their first child. The consequences of the unplanned pregnancy take an economic toll on mom, child, and community. Teen moms are more likely to experience stress that affects their parenting skills. A 2007 analysis found that there are 110 reported incidences of abuse and neglect per 1,000 families headed by a teen mother. And in some cases, the neglected or abused child is placed in foster care, which then burdens the taxpayers with nearly $1 billion annually in foster care costs. Teen moms who are overwhelmed by the demands of parenting and place their children in the foster care system put a financial burden on society. As a female who began having sex at the age of 16, I can relate personally to this topic. My experiences helped me to educate my daughter about sexuality and preventing pregnancy and disease, but more importantly, I educate her on God's plan for her life and sexuality. 1 Corinthians 6, verses 12 through 14 tells us, everything is permissible for me, but not everything is beneficial. Everything is permissible for me, but I will not be mastered by anything. The body is not meant for sexual immorality, but for the Lord, and the Lord to the body. God did not create our bodies for us to use for any and all sexual pleasure, but rather in the security of marriage. I want my daughter and all adolescent girls to know the truth of God's plan for our sexual expression. Following God's precepts for sexuality will ensure a lifetime of holy satisfaction. Thank you.